This presentation is brought to you by the East Bay Regional Coalition. Knowing how to safely use and store your pain medicines is one way to take charge of your good health. The number one reason Americans today visit a doctor is pain. Pain is more common than diabetes, heart disease, and cancer combined. Did you know that adults over 50 are at greatest risk of opioid overdose? This group is often prescribed opioids for chronic pain, but addiction can occur in as few as 5 days, even in low doses, and even if prescribed by a doctor. Opioids can be prescribed under many different names. Hydrocodones include medicines like Vicodin, Norco, and Vicodin cough syrup. Oxycodones include Percocet or OxyContin. Oxymorphones include Opana. Hydromorphones include Dilaudid and Exalgo. Codeine medicines include Tylenol number 3, Tylenol number 4, or may be called Tylenol with codeine. Did you know that guidelines recommend treating acute pain with opioids for just 2 or 3 days, but most prescriptions are written for 30 days? Rhode Island has recently limited opioid prescriptions to 4 or 6 pills per day for 20 pills total. This is to help prevent people from becoming unintentionally addicted. You should talk to your doctor about everything you take. Alcohol, tobacco, and other drugs, including over-the-counter medicines or alternative remedies, such as vitamins or herbs, can all affect how well your prescription medicines work. Let your doctor know if you use any of these and how often. To take charge of your good health, there are several questions to ask your doctor if you are prescribed a new pain medicine. Here are some questions to ask your doctor about a new medicine. Is this addictive? Is there an alternative with less risk of addiction? Are there drug-free alternatives to consider? Can I partial fill this prescription? This means filling the prescription for less days than the prescription is written for. There are several evidence-based alternatives to treating pain. These include physical therapy, chiropractic care, massage, cognitive behavioral therapy, ice and ibuprofen or acetaminophen, or pain neuroscience education. Your doctor or another healthcare provider may help you know if any of these would be appropriate for you. Taking opioids can have serious physical and mental side effects. Physical side effects include feeling overly sleepy, an increased risk of falls, nausea and vomiting, respiratory depression, constipation, poor appetite, and seizures. Mental side effects include problems thinking clearly, depression, and dementia. To keep yourself and others safe, there are some rules to keep in mind. Don't share medicines that are prescribed for you, and don't take any medicine that is prescribed for someone else. Don't drink alcohol when taking medicine unless the doctor says it is okay. Check expiration dates on the pill bottle before taking something you don't take regularly, and be sure to tell the doctor and pharmacist about any allergies you have. Did you know that most prescription opioids misused by high school students are obtained through a friend or relative, not a prescription for them? Family members, friends, or household workers should not have access to your pain medicine. It's important to keep your medicine safe and secure from others, even your family members. Many people who misuse opioids receive them at no cost from a friend or family member, or they admit to buying or stealing opioids from someone they know. There are ways to keep them and you safe. First, you need to monitor your prescriptions. Store your pills in a secure place, count them frequently, and check expiration dates if it's a medicine you don't take every day. Second, use a lock bag to securely store your prescriptions and protect them from theft. A lock bag keeps your medicines private and keeps pills out of the reach of family members, such as children or grandchildren, friends, and workers who may come into your house. Third, there are several ways to dispose of your unwanted or expired medicines. You can drop off these medicines at secure drop boxes located at police departments and some pharmacies. It's anonymous, and police departments are open 24 hours a day, even on holidays. There are also some ways to dispose of unwanted medicines in your household trash. Both Dispose RX and Deterra are easy to use, safe for the environment, and inactivate the pills so no one can use them if taken out of the trash. You can also request a DEA prepaid mailer for unwanted medicines. These will be returned to a secure DEA site for proper disposal. Naloxone can reverse an overdose and can save a life. If you have opioids in your home, it's good to have naloxone on hand in case of accidental overdose. It's easy to use and can be a part of your home first aid kit. There are several ways to learn to use it and have a kit delivered to you at no charge. It can save the life of a family member or friend. In Rhode Island, the University of Rhode Island has a community first responder program. You can visit their website at web.uri.edu/CFRP. There are videos to show you how to recognize and respond to an overdose and other resources to help you or someone you know connect with prevention, treatment, and recovery options. After you learn about how to use naloxone, you may be eligible to request a free naloxone nasal kit, which will be mailed to you at no charge. The East Bay Regional Coalition has worked with the East Bay Recovery Center to create a short video on how to use naloxone. You can watch the video here. Older people might think that only younger people struggle with addiction, or they might think no one could misuse medicine prescribed by a doctor. They may feel too ashamed to admit they are struggling with opioid misuse. But addiction doesn't have an age limit. Like any other disease, addiction has a predictable set of symptoms and requires treatment just like any other disease. If you know someone who feels alone and may not ask for help, you can let them know that there are many people and resources in Rhode Island for treatment and recovery. There are several trusted sites to visit for more information. For local resources, you can visit riprevention.org or preventoverdoseri.org. For naloxone training, visit www.web.uri.edu/CFRP. The National Institutes of Health publishes a safe use of medicines booklet you can download for free. The website thinkaboutpain.com has good resources on alternative treatments. There are also some numbers you can call. BH-Link is at 401-414-LINK. Kodak is at 401-490-0716. SAMHSA has a disaster distress hotline at 1-800-985-5990. You can also text Talk With Us to 66746. This presentation was brought to you by the East Bay Regional Coalition and the Rhode Island Department of Behavioral Healthcare, Developmental Disabilities, and Hospitals.